Sir, namaste and good evening to all of you. I am excited to welcome you to our Monday evening Zoom meeting. I would like to give you a brief introduction about this Zoom meet for the benefit of many new faces who have joined today. VMS Bangalore has a geriatric unit specializing in treating seniors with mental health conditions. The unit is functioning for more than 25 years. Vayomanasa Sanjeevani is an unique brand that functions under the Geriatric unit of NIMHANS. Professor and head of the department, Dr. P.T. Shivakumar, and with the able support of Professor Dr. J. Kumar Hebisheta and other doctors in Geriatrics unit of NIMHANS, are organizing these Monday meetings with the voluntary support of students in the department. They are bringing out for our general guidance knowledge on topics of relevance to seniors through experts in the concerned field. The advantage for seniors is that they can listen to it from the convenience of their home through Zoom and YouTube platforms. This evening, we are blessed with a brief knowledge sharing session by Dr. Sameeksha Das, MD, on the very relevant topic, dementia, risk factors, and prevention. I welcome Dr. Sameeksha Das. I also welcome Mrs. Jyoti Gogai and her team, who are students in NIMHANS and are providing back-end support for the webinar. Dr. Sameeksha Das qualified for her MBBS degree from one of the oldest medical colleges of our country, that is Sri Ramchandra Banj Medical College, Cuttack, Orissa, in the year 2014. She also completed her MD from the same college with a specialization in psychiatry. In the background of her more than 8 years of experience in psychiatry, she had joined NIMHANS and obtained postdoctoral fellowship in geriatric psychiatry in the year 2024. Let us remember that her academic achievement is a challenging one. Dr. Sameeksha Das has recently won IAGMH INTAS Award, third prize, for an original work on SOP formulation for rapid tranquilization in older adults, which is set to be published in the Journal of the Mental Health, Geriatric Mental Health. She has recently published a case report on CJD. This is known as CJD, which says this is a psychic presentation in the same journal. CJD is a rare, rapidly worsening brain disorder that causes unique changes in brain tissues and affects muscle coordination, thinking, and memory. She is also into a project where she is teaching the general doctors, general practitioners about dementia, and this is a project that is ongoing with dementia, and she is teaching that she is currently working on the project in where she teaches psychiatrists and general physicians about dementia. That's that is the background of her qualification. Due to these qualifications and achievements, she is one of the best available doctors in the country for treatment of dementia and allied disorders at VMS Bangalore, where she is currently working as a senior resident. I thank her on behalf of all of you for joining us this evening to spend her valuable time and share her wide knowledge on a highly relevant topic, namely dementia, the risk factors, and interventions. While I do not like to scare anyone here, the available statistics about dementia is highly concerning. Dementia is prevalent in India, affecting about 7% of the adults over the age of 60. Or if it is put in numbers, roughly over 8 crore persons, and it is increasing by the day. Dementia is more prevalent among females than males and in rural areas than in urban areas. Significant cross-state variations exist in dementia prevalence. Several factors contribute to dementia. In this background, it is necessary that we listen to the expert resource person of the day and clearly understand about dementia, risk factors associated with it, and the medical interventions possible to avoid it as well as to treat it. As you are aware, our resource persons are well educated and trained and offer evidence-based possible solutions so that anecdotal information is totally avoided. However, kindly note that the information shared in these meetings are general in nature And for any specific matter concerned with your health, please consult with your medical practitioners and take treatment as suggested. As a meeting hygiene, I request all participants to keep their mic in mute. If you have any questions, please type it in the chat window for the speaker to respond to you at the end of the presentation. If time permits, we'll spend it in answering your direct questions. Dr. Sameeksha Das, madam, let me introduce this group to you. We are a set of mostly seniors, keen in healthy aging for us as well as for this society. With this objective, we listen to experts like you, apply your advices in our daily life, and share the knowledge we gain with our dear and near so that everyone ages in a healthy way. Yes, doctor, the floor is open to you. Please go ahead with your presentation. Thank you.
Thank you, sir. Thank you for the warm welcome and the introduction for this group. I'm delighted to get this opportunity and address you people. So I'll quickly share my presentation.
Screen share is enabled, doctor. Yeah, yes.
Yeah. So hello everyone. Today we'll be talking about preventing dementia. We'll be concentrating on the risk factors and interventions. So coming straight to what is dementia? Just give me a second. Yeah. The nerve cells in the brain, and this affects the functioning of the brain, and this disrupts a different part of communication between the different parts of the brain. So coming to the key features of dementia. So the key features are, first of all, the cognitive decline, which we in general terms say memory loss. So dementia is not just memory loss, it is much more than that. But yeah, memory loss is definitely a very important part. So this memory loss becomes more for recent memories, okay? Whatever recently has happened, recent events, the person has difficulty in remembering this, the recent stuff. So when the people come, the caregiver will tell you that the memory of the patient is very sharp. They can remember the old things very nicely. So the old things will be there. They are consolidated into your brain. So they will retain that till the very end. So what will go first? It will be the recent memories. So whenever you suspect that somebody has cognitive decline, you think, is he having are they having problems with the recent events? They can have difficulty in language, they will have difficulty in communication, and reasoning will also go. And this is the reason, because the judgment in reasoning is impaired. People with cognitive impairment or dementia are prone for these financial scams and scamming people out of money. So this also has to be kept in mind, and they will have a problem in troubleshooting and planning or solving problems. With dementia, we can also see some behavioral changes. Okay, suddenly the person behaves in a very bad manner, impulsive. They will say whatever that comes to their mind, no social inhibition. Sometimes, in some cases, they may also touch people inappropriately, or some disinhibited behavior will be there. So this can also point towards a like a diagnosis of dementia. Okay, so behavioral changes also we can see in dementia. Finally, daily functioning. So dementia has to affect your independence. Okay, only when it affects your independence on your daily functioning will it call it dementia. Okay, so people will have problems in managing finances, in driving, in handling daily routine in later stages. Okay, so there will be an increased dependency on your caregivers. They can be either your spouse, your children, or a paid caregiver. So as the disease progresses, this dependency on these people becomes more. So one thing has to be kept in mind is dementia is different from normal aging. So even in normal aging, as we age, like if I am 35 years old, my memory is not as sharp as it was at the age of 25 years. So when I become 45, it will reduce a bit more. So memory decline is something that is going to happen, but it will remain within the normal limit. So we cannot say that dementia with old age patients are supposed to have dementia. Dementia is natural thing. No, dementia is when this normal process of having a memory issues becomes a largely a very big problem. And when they have this problem that their independence is getting affected, they are unable to do the daily routine activities, or finances they are unable to handle. So the dementia is different from daily routine aging, or normal aging. So why do we need to talk about dementia, and why do we need to prevent dementia? As said, that the impact of dementia is increasing. So we all are going to live longer than our ancestors. The mortality rate is decreasing. The life expectancy is increasing. So we are going to live longer. And as we age, the chance of getting dementia is become higher. So if 15, 52, 59 years of age, if three people have dementia in 1,000 persons, when we reach the age of 80 to 89 years, it becomes 150. So there is an exponential increase with age in the cases of dementia. So we need to know how to prevent dementia. So before diving into the prevention part, it is necessary to understand that brain also has reserve. Like bank has reserve, our brain also has reserve. So what is that reserve? One is the neurobiological brain reserve. So neurobiological brain reserve is exactly the number of neurons we have, the number of nerves we have, the brain matter we have. That is the biological reserve. So if some damage, so one thing you have to understand is with age, damage is going to happen to your brain. This is inevitable. It is going to happen. So if you have a large brain matter, dense brain matter with nerve cells, synapses, neurons, so this damage is going to affect you less. Somebody who has less brain matter, in the sense less number of neurons and synapses, they are more prone for dementia, because the disease process is going to become evident earlier. So if you have a large amount of money, somebody takes away your money, still you have a large amount. If you are already poor, you cannot afford to lose money. So that kind of thing. So that is your neurobiological brain reserve. There is something called, but this neurobiological brain reserve is biological. It is something that we are born with, or it comes from genetics. So we cannot change that. So when we talk about prevention of dementia, we do not talk about neurobiological brain reserve, because that is what we will get by genetics, or that is going to be there since the beginning. But what can we change? We can change the cognitive reserve. So what is cognitive reserve? Cognitive reserve is the adaptability enabling preservation of cognition despite brain pathology. So if you have a good cognitive reserve, we will talk about cognitive reserve in the further slides. So if you have a good cognitive reserve, even if there is some brain pathology, some brain damage is there, which is, as we said, is inevitable. So if there is brain damage, then you are able to handle this damage better. So you have some reserve. So even if something is gone, you are able to do your work. So adaptability is there. So this is something which is changeable. Okay, this depends on the lifestyle choices and other things. We'll talk about it. So we are mainly focused that we should have a good cognitive reserve, because that is in our hands. Okay, biology is not much in our hands. So brain maintenance is neurobiological capital at any point based on genetics or lifestyle, reducing brain changes and pathology over time. So I want you to remember there is something called cognitive reserve, which is responsible for dementia. Like it's a protective factor from dementia. The higher the cognitive reserve, the more resistant you are for dementia. And this is changeable. Like we can affect, like we can work on it. Okay. So cognitive reserve. So what is cognitive reserve? How can you increase your cognitive reserve? So cognitive reserve is dependent on mostly two things. One is your educational level. So the more you study, okay, the more educational levels you have, the more years in education, or the more active you are in your occupation, okay, or you are actively reading, actively language is very good, then education, then you will have a good cognitive reserve. So the main principle is the more you keep your brain active, the more better it is for you, the more resistant you are for dementia. So cognitive reserve depends on educational level, and another is lifestyle. So in lifestyle, we'll talk about what are the changes we can do. So social activities and cultural activities. Just a second. Yeah. So the higher social activities you have, the better cognitive reserve you have. The more culturally you are active, the more cognitive reserve you have. So when we talk about dementia, we should know the pathology of dementia. So what happens in dementia, the brain pathology sets in way before the symptoms of dementia appears, okay? maybe at the age of 65, somebody has forgetfulness and other symptoms, the brain pathology or the disease process has started way back. So it will reach a stage when the symptoms will appear. So we have a window where we can either stop, prevent worsening or appearance of symptoms of dementia. We cannot stop the progression. So there are certain modifiable risk factors which influence the rate of development of underlying neuropathologies. Okay, or these modifiable risk factors, what they can help is whatever damage is being caused by the pathology or whatever is, if it is AD, then we have a certain kind of pathology like neurofibrillary tangles and all that, that deposition will be there. So, but your your risk factors will help that this, maybe the symptoms of dementia will take a longer time to appear, even if there is brain pathology. Okay. In simple words, if you keep oiling the engine, if you keep oiling your motorcycle, even if the motorcycle is getting wear and tear, it is going to run for a longer time. So in the same way, there are modifiable risk factors which can help you maintain the brain or brain functions for a longer time. So when we talk about dementia, we talk about the delay of clinical onset of disease. Like the disease process is going to happen as we discussed. So we should concentrate, or we have to concentrate on the appearance of symptoms rather than the progression of symptoms or the progression of neuropathology. Because we don't have much control over the progression of neuropathology. Like in Alzheimer's disease, if the disease process is set in, it is going to happen. What can we prevent? We can prevent the onset of symptoms. Maybe we can delay the onset of symptoms. So dementia is only when it becomes clinically apparent. The progression may be there since years and years. Only when the symptoms are appearing, there is difficulty in maintaining your independence, only then we call it dementia. So dementia can be delayed, at least the onset can be delayed and the symptoms can be delayed. Okay. So there was a study done, and this is in 2024 report of Lancet. So dementia prevention, intervention and care. So what did they found? These are the symptoms. Just a second. These are the factors that affect dementia, or that are risk factors for dementia. And these are the factors that have to be worked on, or we can work on. So these are modifiable. It can be changed. It can be controlled. Okay. Certain things cannot be in control. Like you cannot control your age. You're going to age, and with age, you're going to have certain risk factors, certain risk of creating dementia or having dementia. As I said, when you become 80 or 90, the chance of dementia becomes much higher. So age is something which is not modifiable, and even women have a higher chance of getting dementia than men. So it has been seen. So you cannot change your gender. So gender, your age, even family history. If you have a family history of dementia, there is a chance that you will get dementia when you age. So these are the things that we cannot change. What can we change? Those are called modifiable risk factors. So according to this 2024 report, what are the modifiable risk factors? One is less education. Because we have studied, we have talked about that education can affect the cognitive reserve. So less education is a risk factor for developing dementia. So the more you are there in school and college and then university, post-university, the better it is. Okay. So hypertension. We'll talk for certain things, we'll talk in detail. Okay. So hypertension, hearing impairment. Okay. Smoking, both active smoking and passive smoking. Obesity, depression, especially untreated depression, and physical inactivity, diabetes and uncontrolled diabetes, low social contact. Okay. Then alcohol consumption, any traumatic brain injury increases your risk of dementia. And air pollution, which is very relevant to our age right now, because we are dealing with air pollution a lot. And untreated visual loss. So any kind of sensory deprivation, it can be hearing loss or vision loss, will aggravate or increase the chances of dementia. And high LDL cholesterol. Okay. So these are the risk factors that we have observed, that has been proved to take part in the progression to dementia. I hope you all have seen all this.
Yes, sir.
Okay. Yeah. Okay.
Go ahead with the next.
So coming to the lifestyle interventions. Okay. So our goal is to maximize our healthy brain, and we delay the onset of symptoms. So how can we do? As we discuss the risk factors, what we can do to work on these risk factors. So there will be certain things I'll keep repeating. So just bear with me. So one is stay physically active, okay? Either walking, dancing, or yoga, and then adopt a healthy diet, okay? So there are certain examples of diet like Mediterranean diet, DASH diet, MIND diet, okay? So adopt a healthy diet. Then you engage in mental exercises. It can be puzzles, reading, newspaper, discussions regarding that, okay? So the longer you keep your brain active, the better it is for you. And this is mainly the reason people who are more into labor or manual work, they have more chances, maybe farmers or laborers, they have more chances of getting dementia because utilization of brain in this kind of work is very less. Whereas people who are like into academics or clerks and all that, who have a bit of mental stimulation throughout their lifestyle, throughout their life, they have a better chance of resisting dementia. So engage in mental exercises, puzzles, reading, Sudoku, whatever you feel like. Then maintain social connections, okay? However, you don't like to meet people, it is healthy for you to establish some social connections. We'll talk about it more. And then manage your chronic condition because these diabetes, hypertension, high cholesterol, or these are vascular risk factors. What do? They narrow your they like hypertension can cause hemorrhage, and cholesterol and all these can narrow your blood vessels and can lead to micro infarcts and micro hemorrhages. Okay, brain may oxygen is reaching less, so that is why you have to manage these vascular risk factors because these are also the risk factors for stroke. So once stroke can happen, then you can have vascular dementia because with stroke, what will happen? A part of your brain will be destroyed. Some recovery may happen, but a brain which is degenerated or destroyed, we can never get it back. So you have to manage your this chronic conditions very well. Diabetes has to be controlled because it will lead to a lot of microvascular changes and, as I said, stroke. So these are the risk factors for stroke and also dementia. And avoid smoking and limit alcohol consumption. So all this is very preachy that do this, do that. We'll talk about what actually we can do. So maintain healthy behaviors in midlife. It is not just at the old age. Maybe in midlife, if you start, we have the best chance of avoiding the risk of dementia. So the risk of dementia is lowest in people who have healthy behaviors between the age of 40 to 65. And protect your hearing. Use hearing aid. We have seen a lot of old people or people with hearing loss who are very resistant for a hearing aid. It can be a bit annoying and it will take some time to get adjusted, but it is very good for you, not just for the sake of like dementia or cognitive things. Even sometimes we have seen that if you don't use a hearing aid, you start hearing voices. Okay, sensory deprivation can sometimes lead to some kind of psychotic symptoms or psychosis. I'm not scaring you, but use hearing aid. It is going to help you with your not only cognition but also prevent you from having any other diseases. And excessive noise, say you have to protect your ears. Okay. So another thing is reduce exposure to air pollution and tobacco smoke. It is not just that you stop cigarettes, you also should have to avoid second-hand tobacco smoke, okay? And prevent head injuries, okay? Because post-traumatic head injury is a very common risk factor. So you have to take steps to prevent fall and head injuries, like wearing proper shoes with non-skid soles. And if you have a tendency of falling, if you are getting into age, you should fall-proof your home, okay? And maintain a healthy blood pressure. So you can aim to maintain a systolic blood pressure of 130 millimeter HD or less in midlife. So I think after 40s, if you have anybody, if your kids are after like reaching 40 or 40 plus, then the general advice should be to get their BP checked, to get them screened for diabetes and other things, because this is when these diseases set in and it takes a long time for diagnosis. So an annual checkup maybe is necessary. So like we said, exercise, exercise, exercise. So how much have to be exercise? How much we have to do and how often we have to exercise. So to help prevent dementia, the experts recommend engaging in aerobic exercise for at least 150 minutes per week of moderate intensity or 75 minutes per week of vigorous intensity activity spread across multiple days. So what exactly is aerobic exercise? So aerobic exercise examples are walking, running, jogging, swimming. So whatever is using your large group of muscles together and in a rhythm. So jogging mein waisa hota hai, swimming. So whatever you can use a large group of muscles together in a rhythm. Also, whatever exercises will increase your heart rate and it will take in more oxygen into your body. So those are called aerobic exercises. So if you are unable to do high intensity, you go for medium intensity, 150 minutes over the week, or 75 of high intensity, and you can divide it over the several days in a week. So this is going to help you prevent dementia. This is also going to reduce your vascular risk factors. Okay, so this aligns with general physical activity guidelines for promoting both brain and heart health. So the brain, heart, and our whole body is related. So you have to protect the heart to protect the brain also. So like we discussed about the diet, so I told you there are several diets, mainly Mediterranean diet, DASH diets, and they have now combined those two to make one diet called MIND diet. Okay, so in MIND diet, this is what we can eat, what we can eat more. Like you should eat more whole grains, berries, raw greens and vegetables, beans like dals, legumes, fish, poultry, olive oil. Okay, this is something that you can eat more. What you should avoid first is saturated fats like margarine, butter, and sugar. So, sugar and fat you should avoid and go for more unprocessed and unpolished foods. Okay, cheese, fried food, fast food, junk, butter, margarine, pastry, and sweet. This you should eat less. Okay, this is based on the MIND diet. So, okay, we keep saying how much alcohol, like you stop taking alcohol, you stop taking alcohol. In case you're taking alcohol, please make sure that you're taking less than 21 units of alcohol per week to reduce the risk of dementia. So 21 units of alcohol. Also, you have to keep in mind that most of these statistics are based on the Western population who are bigger than us, more sturdier than us. Okay, they're like more body surface area. So maybe less than that also we should aim to do something less than that. Okay, so there is an institute called National Institute of Alcohol Abuse and Alcoholism, NIAAA. So they recommend that men should not have more than 2 drinks per day and women should have not more than one. So how do you calculate these units? Like 21 units, how much is it? So you can take any volume of drink you take. For example, if you take beer, for example, if it is 5%, then 5% into 500 ml divided by 1000. So it will come out to be 2.5 units. So this is also the calculation given. So how much you are drinking ml into the alcohol by volume percentage divided by 1000 will give you units. And you should keep it less than 21 units per week. So what are the other things that you could do to prevent or slow down dementia? So we talked about social isolation as a risk factor for dementia. So our motive should be to increase the social contact. You can also do that by volunteering, joining a club or a social group, visiting your local community center or senior centers. Uh, this is mostly okay. So in Indian context, maybe like going to the temple, because in India we are very religious. So going to the temple, taking part in all those activities, or any kind of like at the local level, any activities is there. There is definitely an advantage of going there, taking group classes, getting to know your neighbors, and making weekly dates. So meet your friends very often, and getting out and going to public places. So I have included this to talk about how we can reduce the risk factors of dementia over the lifespan. So when we are born, it is better that we avoid parental smoking. So all of us should be aware that parental smoking can lead to reduced cognitive reserve in children. So avoid parental smoking. There is a disease called ADHD, attention deficit hyperactive disorder. If there is detection and you treat ADHD because it has shown to have some connection with dementia. And then over the years, then you continue in education, optimize diet and nutrition throughout your life. Okay, so optimize diet and nutrition, less sugar and less saturated fats, more cereals, more grains, and more vegetables. And you exercise regularly. You detect and treat depression. As we said, depression is a risk factor for dementia, thyroid disease, hormone, and vitamin imbalances. Because all these, like hypothyroidism or any kind of hormone imbalance, can also cause cognitive impairment. Okay, you avoid smoking, maintain a healthy weight, and manage hypertension. As you get into the middle age, you manage hypertension, treat and detect diabetes, maintain cognitive activity, especially after you retire. because all of us who are here must have done some job which requires mental stimulation. So what happens is after retirement, the stimulation stops suddenly. So you have to keep in mind that even after you retire, you have to have certain uh, hobbies or certain activities which can keep you cognitively active and monitor for cognitive decline, treat earlier signs of dementia, and use cognitive compensation strategies and devices. Even if you have some forgetfulness, like a lot of old people and a lot of us are going to experience some kind of forgetfulness. So something can be you write it down or you make notes or you keep reminders so that this will help you not forget stuff and keep the important things or important events in check. So use cognitive compensation strategies and devices, okay? So community and support. So supporting each other is the key. Join local health initiatives as you guys have done and dementia awareness programs. Caregiver support groups provide valuable resources and advocate for policies that promote brain health and early intervention. So lastly, coming to the take home message, take action today. Preventing dementia starts with you and make healthy lifestyle choices. Stay informed about risk factors and interventions and encourage friends and family to prioritize brain health. With this, I come to the end of the presentation. Thank you.
Thank you, Doctor. And that's a very precise and beautiful presentation, beautifully explaining how the best ways to prevent dementia. Doctor, can you just throw some light on what are the treatment options available for dementia?
Can you just repeat the question? Sorry.
Yeah, Doctor, can you tell what are all the treatment options available for dementia? And is there any test that can find out whether a person is getting into dementia? Or, I mean, how to go about? See, because as you rightly pointed out, forgetfulness is something that is taking place always. So, therefore, whether any forgetfulness is dementia, or what is that which differentiates dementia from forgetfulness? That will be very useful, Doctor. As a take
Sir, sir, there is something called benign senescence, benign forgetfulness or benign senescence, in which we say that with age there are certain forgetfulness that we will experience. So this forgetfulness is mainly that you may forget some things at the moment. Like somebody asked me, ki, "Oh, what was your teacher's name?" I may not give them the answer immediately, but after sometimes I will be able to remember. So even if there is some lag between remembering, that can come into normal aging. Okay, and generally the people will become slower. They'll have more time recollecting or recalling these things, but that also we can take in normal aging. We call it dementia. Like I said, when it interferes with your ability to perform your daily routine activities or something which is more complex, like you are unable to do your taxes, you're having problem in filing taxes, you're having problem in shopping, you're having problems in cooking your daily food. So when it affects all these routine, like it is getting affecting your daily routine activities, then it becomes a sign that you may have developed dementia. So whenever a patient comes to us, or sorry, a person comes to us and they have this concern that I'm forgetting stuff and we are not able to remember stuff. So we have to see how much is this affecting their daily routine or how much they are affecting their daily life. If that is not much, then we can think it is normal aging. We also will run some tests in the sense of standardized tests where we ask you certain questions to see what is your, like, how is your memory doing right now? And if you score well between normal limits, then will assure you that your memory is within normal limit. And whatever your experience is probably a part of normal aging. Also, sometimes when we are anxious or depressed, we tend to be more forgetful, especially in anxiety, we tend to be more forgetful. So you have to keep in mind that even when you score badly in a test, like in a memory test, we have to see that are you anxious? Because sometimes even the notion of being tested for memory becomes very anxiety inducing. So these are the things that you have to take in mind. So another thing, like there is no specific test, but one more thing is that we can do a brain scan. Especially, it is good to do a brain scan to see what is the baseline. So if we do it after several years and you are really experiencing something, we can see if there is any degeneration happening or not. Okay, it is not mandatory, but it is good to do. So at least if nothing is there, we can see how was your brain 5 years back, how is it now, and is it coinciding with the symptoms.
Okay, doctor, is brain scans, I mean, how expensive these brain scans are? Is it easily available? Yes.
Yeah, so there are two kind of brain scans available, sir, at least right now in NIMHANS. I'll talk about NIMHANS. So there is one called MRI. So this is structural MRI. So they will take a picture of your brain and see how are your brain, like structure kaisa hai. Is it the volume is okay or not? Every proper structure is proper or not? So in dementia, when the dementia progresses, your certain brain lobes or certain brain parts will become shrunken. So then it is a proof that, okay, you have some degeneration. But in early cases of dementia, this degeneration or this shrinkage will not be there. What will happen is ki maybe your frontal part or this, in Alzheimer's, what is happening is this temporal part and parietal part is affected. So what will happen is the activity in the brain activity here will reduce. So that will be shown in PET MRI. So structural MRI, I think it's cost 5,000 rupees, and PET MRI, it costs 7,000 rupees. There are certain projects also going on. If possible, we can recruit certain people and do it for free, but it can't be done for all. But this is the cost in NIMHANS, 5,000 for structural MRI, and PET MRI is 7,000. If you are going, PET MRI is 5,500. Yes, sir, 5,500 or 7,000. If you're going for something and you can afford it, I'll tell you, do a PET MRI. But all these are not important. It's morely when we diagnose, it is clinical, that how much your memory is there by standardized tests and how much problem you are facing in your day-to-day activities. MRI may only help in diagnosis. It may not lead to diagnosis. And you understand, only supplementation can be there by MRI. It is not at all very necessary or mandatory for that.
Yes, doctor, that helps because, and you are suddenly used one word, Alzheimer's. See, that is, I mean, can you just, I mean, I know that Alzheimer's is one part of dementia. Can you just lay a little more light on that, doctor? Because we have not used that word all along. Suddenly the word,
sir.
yeah.
Yes, everybody should know about Alzheimer's disease because that is the most common dementia that we face. Okay, almost 60 to 70% of dementia is Alzheimer's disease. So what happens is the temporal part, this part of your brain and that part of your brain starts getting affected. So there are certain deposits in your brain. If they increase a lot, then you can have Alzheimer's disease. That is another neurobiology. And like we have always said that, believed before learning about all this, dementia is forgetfulness. So Alzheimer's is a disease in which the main symptoms are forgetfulness. You will forget recent memories, recent things. Then you will sometimes forget routes, how to reach a place. So this is what we call Alzheimer's or AD. So this is the most common type of dementia. Most commonly we see forgetfulness.
Forgetfulness is basically, I mean, this Alzheimer's dementia. Or, so, and yes, I mean, Alzheimer's, see, in fact, I have come across large number of cases of Alzheimer's dementia. I mean, they also say that there are, I mean, supposing it is detected at an early age, then you can stop the progression to a large extent. How true is it, doctor?
So like we discussed, the pathology we cannot stop. The pathology is going to happen. We have certain new drugs which has tried to stop the pathology, but we have not had much success with it because some side effects have been seen. So it will take a long time to refine those medicines. But progression in the sense of clinical symptoms, we can delay by keeping the person mentally active, cognitively active, by physical exercise and all this. The more active you are, the more it is going to prevent setting of the clinical symptoms. Another thing is, like other things we have to see that is there anything like sometimes with Alzheimer's, we develop depression because we could understand that, okay, we are losing memory. So we have to keep everything else in check. We cannot do much about the progression of dementia. We have to just see how much the brain function is left. We have to utilize it to the maximum. Okay, so that we can carry it forward more.
Yes, doctor. For that,
sir.
Today, one second, madam. See, Doctor, in the context of the present day where you have got large number of gadgets and apps, etc., etc., can you suggest anything that can help people with this? I mean, any particular gadget or any particular game or anything like that, say like Sudoku or something like that. Do you suggest that, doctor? And and one more complaint is that today more people are using more time on these devices also. I mean, by per se, is that a problem, or do you think that it can be allowed for the seniors?
So it depends what are you doing on the phone. If you're just simply watching, like passively watching some videos or that, then it is not of much use. But sometimes we can play games or Sudoku or anything on the phone. That to some extent is acceptable. But still, we will want that rather than the person playing themselves. If the family members come together and play, it can be anything. It can be as simple as Ludo or Snake or Ladder or Sudoku. Together, it is more helpful than the person playing themselves or friends playing together. It is a much more beneficial thing.
Okay, doctor. Therefore, I mean, being in social contact and moving with people probably is one of the biggest advantage to avoid dementia, isn't it?
Yeah, definitely,
Thank you,
definitely.
doctor. Thank you, doctor. So somebody was
Okay.
raising some questions. See, before that, there are some questions in the chat box. See, Ram Shankar has raised one question, doctor. Dr. B.M. Hegde is of the view YouTube. He says that Mediterranean diet is good for Mediterranean people and not for us. What do you think about this, doctor? You have spoken about some other diet also, a combined diet. So,
Sir, so Mediterranean diet mein there is something called they use olive oil a lot. So they use olive oil a lot. They will also even suggest that you take red wine because for them it is advantageous. But olive oil for Indian cooking is suggested. Generally, the dietitian will say not to use olive oil in Indian cooking. So that is why there are other diets also like DASH diets. So they have combined it and made into a mind diet. So there we have given very broad things that you eat less sugar, which is, I think, applicable to everyone, that you eat less sugar, less processed fat, and more green leafy vegetables, cereal, like legumes and dal, and all these things you eat more. If you want to go for non-veg, don't eat red meat. Go for poultry or eggs or fish, not even eggs, fish, which we have known to have better performance for cognition. So I'm not telling you. So olive oil. Yeah, okay.
No, I understand. See, in fact, as I have right at the beginning, I have said that this is whatever you are talking is about evidence-based. See, we are not talking something anecdotal here at all, because you are all experts in the field. You will be talking only about what is evidence-based. I understand that.
Yes.
And Mr.
Yes.
Tangaraja has asked one question. Diet for seniors may be explained. What exactly is the diet for seniors?
Okay, so I am not very qualified for that. I told what maybe a other person will be better, but like we discussed, less sugar, less saturated fats, more proteins, protein in the form of poultry, or more green fibers is important, more green leafy vegetables and other vegetables, and whole grains rather than processed food. Go for whole grains. So this is going to give your a good gut health. And this is going to be better for your mood, for your depression, and for your cognition. So I think this diet is made so that it covers a lot of things like vascular risk factors. Also, it covers. It also is thinking about your gut. So gut also is related to our brain and our mood. So that also will help take care of gut. So more fiber, more protein, complex carbohydrates. You should avoid sugars and fats. Okay, so certain fats are good, but saturated fats like margarine, butter, you can avoid. And it is nothing that you can't eat those things, but it is you keep it in moderation. More try to include all these better things in your diet.
Okay, next question is, please explain the biological principles of high LDL causing dementia.
So all these, sir, what is there? Cholesterol is very like it can cause narrowing of arteries. So higher the bad cholesterol you have, the higher chances are that your arteries are getting clogged. So if brain arteries are getting clogged, your brain is having less oxygen. Okay, the brain ischemia is going to increase. So this is one of the reasons that dementia can happen. Like vascular risk factors भी increase होता है. Okay, so one or another risk factor is dementia, vascular dementia. So LDL can also increase vascular dementia.
Thank you, doctor. Thank you. And then again, one more question is that, doctor, is slight hearing impairment relates to, can lead to dementia?
Yes, definitely. It is nothing slight or more. If you have dementia, if you have, I will just request it to everybody that even if you have the slightest of hearing impairment, get it checked by ENT, and if needed, you have a this thing like hearing aid. Sir, what happens is, like I told you something, like you still told me something, whatever you said, ki, Dr. Sameeksha, are you coming today? Okay, so I have this hearing impairment and I'm not paying attention to it, because for memory to be formed, you should have some input. Only if I have an auditory input, that it will be processed and made into memory. If input is not there, how will it be made to memory? You understand? So for input only, we need to have sensory, like modality should be fine. So for the formation of memory only, we need to have sensory information. If sensory information is not reaching the brain, how is the brain going to make it into memory? So that is why there will be cognitive impairment. And sometimes we have seen in our clinical practice people who have sensory impairment. When you can't hear anything, you start imagining noises. Okay, so some hallucination and also will start. So if there is sensory impairment, please try to get it checked.
Thank you, doctor. See, Mr. Shivakumar has raised one question. Is there,
Yes, sir.
Can you just raise it? Can you just make it straight? See, because I'm not understanding your question. Is there degeneration of amyloid and pair proteins in neural dementia? How to prevent the degeneration of these two proteins? I think more.
Sir, it is under research right now. We don't have much thing that can prevent degeneration. So degeneration is something going to happen. It depends on your genetics. It depends on your age that degeneration is going to happen. Some people are more prone. Like there are certain genes, if you have, you are more prone. And sometimes sporadically also, we will have that degeneration. So we cannot do much about degeneration. There are certain, as I discussed, certain medicines which are on the way, that we are still looking at it. We have not approved it because of some side effects, which what they did was they targeted these deposits, but we have not like found, like safety wise, it is not still very safe. So we are not including that now. But degeneration is something that is going to happen, sir. The brain is going to age, and if there is some degenerating process, this is going to do. So our goal is never to look at that degeneration, because we still have a long way to go when we talk about this degeneration, and we develop facilities to stop this degeneration. What we can do is we can increase the cognitive reserve or talk about the modifiable risk factors.
So we are now talking about modifiable risk factors only here. See, therefore, getting into that, treatment, etc., I think they will have to consult their own medical practitioners who have to decide whether a PET scan is needed, etc., etc. Is my understanding right, doctor?
Yes, sir. Yes, sir.
So that is, in fact, some people have raised questions on that. So, one more question is that pranayama. See, nowadays we are talking about that. Is there any connection between pranayama and reduction in dementia or something like that, doctor? Any study has been done on that?
Definitely studies have been done, and yoga is definitely a very holistic approach where we talk about meditation. You also include it with physical activity. So it is definitely very helpful for dementia. And if possible, I always suggest that if not anything, you can start yoga at your house. So yoga is definitely very helpful.
Yeah, thank you. And then one more question our Sangaraj has raised is, avoiding completely sugar or jaggery, is it good?
Sir, I can't also avoid the completely sugar or jaggery. You
Yes.
take in moderation how much you can sacrifice, you sacrifice, but we all are humans. We all want to have some sugar. So it's okay. Like if you can, however you can reduce, you reduce. But I wouldn't say, no, you abolish it completely. Maybe go for fruits or something which have natural sugar rather than added sugar. So that is another alternative. But yeah, sugar is definitely one of very high risk factors for a lot of diseases.
Yes, Doctor. Thank you. Any home remedies on early stages of dementia because of lot of work stresses? I mean, is there
Sir,
anything?
if you suspect that you have dementia, I will advise you to come to us. Any doctors, you are most welcome to come to NIMHANS. Our services are very free and very nominal fees, because it is that dementia, first of all, sometimes it is normal forgetfulness and people think it is dementia, and that causes extreme anxiety and some depression, and that also worsens your memory. So let you come to us. We will talk about it. We will see, I actually have any cognitive impairment, or it is just normal forgetfulness, or you have some stress or some depression or some anxiety that is causing all this, and then we can talk about all these things. You want to do something at your level, sir, as we discussed all these things, go for exercises, go for socialization, and then if you feel the need, you please come to us. Okay.
Thank you, Doctor. See, in fact, Padma has asked one more very, very important question. Is there any connection between Parkinson's and dementia?
So dementia is a broad term. So dementia, we can have a lot of diseases. So one is Alzheimer's. If I keep saying one dementia, uh, doubts will come up. But dementia, Alzheimer's dementia, vascular dementia. So Parkinson's is actually a disease in which we see a lot of motor movements, that trembling of hands. Then the person will become stooped. They will walk very slowly, and all the activities become slow. So that is called Parkinson's. And Parkinson's may turn into dementia gradually, or eventually may have dementia. So Parkinson's disease, Parkinson's dementia is also a thing which can happen in Parkinson's later in the course. So there can be motor symptoms of dementia where there is restlessness and then trembling and slowing of activities, and there can be cognitive symptoms of dementia. Okay, so dementia can happen in Parkinson's also.
Therefore, I think the best course is for them to get examined for dementia also. If somebody is having that Parkinson's disease or something like that, better to protect them from dementia in all possible. Okay, Dr. Yes, has NIMHANS come out with any specific exercise to improve cognitive ability, Doctor?
IMD, I think the IMD department, the Ayurveda Integrative Medicine department, do conduct yoga classes where you can join virtually.
Virtually, yeah. Maybe every day from Monday. In fact, I am sharing that link every after the meetings, Doctor, because they conduct Monday and Friday. The classes open at 6:50 a.m. to 7:50 a.m. Yes, that
So Naveen,
tell me, Doctor. Please go.
Yes, sir. So Naveen, sir, there is nothing. Sir, walnut is good for dementia. It is a nut, so all nuts are good. Not cashew nut, but nuts like walnuts, almonds. These things will definitely, they have good protein and good fatty acids. Good fatty acids, which will help.
Yes, Doctor.
Another thing is, one thing is key. As we discussed, aerobic exercises like simple walking, jogging, swimming, all these are very good exercises because it increases the blood flow and oxygen levels to your brain. So that only.
Padma Madam, we have answered your question. Do you have still Madam, any question?
Yes, sir. Thank you so much. I just want to know one more thing. Is Parkinson's reversible?
No, sir. No, madam. As we discussed now, any kind of neurodegeneration which is affecting your brain, wherever there is brain is affected, it's not reversible, because there are other cells like liver. If you cut in half our liver will grow back. It has regenerating properties, but brain doesn't have that regenerating property. Okay, so that is why if something happens to the brain, it is very drastic because brain cannot regenerate. Maybe liver can regenerate, certain organs can regenerate, but brain does not have regenerating power. So any kind of disease which is causing brain damage, degeneration, it cannot be reversed, but it can be managed via medication to some extent. Okay, but progression will be there.
Okay, thank you so much.
Thank you, Doctor. And okay, see, I mean, I think some technical question has been raised by Mr. Naveen Kumar. Does transcranial direct current stimulation treatment help in dementia?
So TDCS is transcranial direct current stimulation. So this is something that we are working on, and we are seeing that we have gotten some result, but it has not been not a very big role. It can help to some extent. This is something that we try and can be tried if needed. But I won't say that it can give you very drastic result. It will give you certain benefits, but not drastic results.
Is oxygenation good or bad for degeneration of brain cells? Would antioxidants help in preserving brain cells?
Huh?
So antioxidants are in general a good thing and good for your overall health. So they will also help in brain health. And oxygenation is good, sir. It's not going to be over oxygenated. So oxygenation is good. So that is why we do aerobic exercises.
Oh, that helps, doctor. See, I think
Yes, sir.
we have already overshot the time. See, let us
Yes, sir.
respect doctor's timings because doctor is very busy doctor. So, in fact, I mean, at this stage, I would like to, wind up if there are no other questions.
Just last question I'd like to address because this is important. Senior citizen taking medicine for comorbid ailments. These medicine have side effects of dementia. Yes, sir. So these are two things you have to remember.
Doctor, you are muted. Doctor, you are muted. Doctor,
Sir, net disconnected.
disconnected. Yeah, wait. Wait. I'll just call her. Padma madam, please mute madam. See, you
have
are,
to control other things. Diabetes.
madam, you are been, you are not heard for a long time. Doctor madam.
Sorry, I got disconnected.
Yeah, you got disconnected.
Yes,
Yeah.
sir.
Just 1 second.
Yes, sir.
I'm just reaching her.
Hello, can you hear me?
Not that. 1 second. Yeah, go ahead, doctor.
Yes, just a second.
Yeah.
Is there any question? Yeah.
That's the last question you have wanted to answer.
Senior citizen taking
Yeah.
senior citizen taking medicine for comorbid ailments. These medicine have side effects on dementia. So all medicines will have side effect. You have to keep in mind all medicines will have side effect. Okay. Any medicine will have side effects, especially in old age. But at the same time, you will have to remember that the more you keep your BP in check, your hypertension in check, your diabetes in check, your cholesterol in check, that is better for your cognition. Okay. Any kind of side effects you are seeing, like if you are developing that sodium has become less due to some hypertension, some medication of hypertension, that can sometimes lead to some difficulty in your memory or orientation. So you have to discuss it with general physicians or psychiatrists. Okay, they can give you a better approach depending on the medicines you are taking. But your focus should be to keep your risk factors into check, like diabetes, hypertension. Okay, because worsening of this will cause you more harm than any medicines ka side effect. So if you don't keep diabetes under control, you don't keep hypertension under control, you may have a stroke, and that can lead to vascular dementia. So keeping these in check is more important rather than being concerned about small side effects of medicines. Okay.
And your doctor also knows before prescribing that these are all the drugs that you are taking. Therefore, the possible side effects can happen. Therefore,
and one more advice is, sir, whenever you go to any psychiatrist or any physicians, you take whatever medications you are saying you are taking. It is a good practice to take all the medications you are taking, so that the person, especially we want that you bring all the medications so we can know that what you are taking, and can there be side effect of these medications on your health, on your mental health, or on your physical health. Okay.
Prabhakaran sir, right at the beginning, we told you that here we are talking about only, I mean, evidence-based things. See, Kashayam, decoction, etc., may be good, but that is Ayurveda. We are not talking about Ayurveda here at all. Therefore, kindly let us, I mean, I have not interested in putting this question to the doctor at all. And we are already overshot the time. So, doctor, thank you very much. See, we have received lots of appreciation, doctor. Almost
Thank you,
everyone has appreciated your presentation.
Thank you, sir.
It has very clearly explained what are all the risk factors for dementia and how one can prevent himself. I mean, how one can avoid dementia for that. So, doctor, I mean, what we on our part, we pray to God to shower on you and your family. All that are the
Thank you
best.
so much, sir.
So,
Thank you, sir.
that is the only best wishes that we can forward for sharing your excellent knowledge with us, doctor. Thank you.
Thank you, sir.
We hope to meet
Thank
you
you,
in
sir.
some other session, doctor.
Thank you, sir. Thank you.
Thank you. Very
Sure.
kind of you.
Bye.
Thank you. Bye.
Thank you, sir. Thank you, everybody.